Personally, in the 1980s, when all of this was kind of starting at a community level, I was the mom of a daughter with Down syndrome, and I started learning about all these amazing community resources. But then I also got connected to families who said, okay, what are all these resources and how do you make them work and how do you navigate through them? And then I met school people who said the same thing. We've got kids with these needs and all of these resources in our community, and we're not sure how to link all of these things together to meet the individual needs of those kids. So as time progressed, I think we've gotten better and better at the notion of collaboration and working together. And in the last 15 years, Family and Children First Councils have come to pass in every county in the state of Ohio for the purpose of bringing us all together to look at the comprehensive needs of children and families. And I think that's a really important part of the discussion. As educators, you work with the children, and you also interact with families, but the complex nature of families need to be part of all of our discussions. Over the last 15 years, we've learned a lot in Stark County about school community partnerships, and family councils are charged with setting priorities based on needs assessment information and evaluation as to what children and families need. Many of our councils have established school community partnership as a key priority for our collaborative work. And we've set out to support that effort with lots of different initiatives in aligning resources to that effort, writing grants, looking at how things are funded, and trying to come up with ways of providing services in schools in partnership with schools. In our county, we started by just listening to schools and what they needed. And we started working with schools on developing alternative school programs and mental health consultation in schools and other services that help them meet the needs of students in a better way. About 10 years ago, in one district in our county emerged. They had created a model in which they brought in community resources into their district. It was Fairless Local School District. And they had put a combination of services together that were working for them. They were getting outcomes. We could measure the improvements in school performance. And in that mix, we had drug and alcohol prevention services, we had mental health services, we had family outreach services, we had safety and law enforcement involvement, academic assistance, and after-school programming. And all of those things were going on in a coordinated way, because what they established is what we now know as a care team within their school building that met on a regular basis to coordinate and create a referral system for students. We call it an operating system for all of these resources within our school. Strong school leadership, much like we talked about today, is essential, and we've learned a lot about that. Today we have a full-fledged community initiative known as the Ohio Stark County Care Team Initiative, and we have strong support from our systems partners, and we have an executive committee made up of representatives from United Way, our Mental Health and Recovery Services Board, our Educational Service Center, Department of Job and Family Services, and we have a juvenile family court judge that also sits at the table to look at what our community needs to do to support the development of this initiative in all of our school districts. Family and Children First is a vehicle, and I think House Bill 1 is going to formalize the connection between schools and the community systems in that will help promote better and greater school community partnerships in the future.